Topic and research design presentation and rationale. The effects of group cognitive behavioral therapy versus medication treatment. A brief introduction. Well, first, we'll discuss a specific research question. Next, we'll discuss the importance of the topic and research question. A brief literature review will be addressed. We will address 2 published research studies as well, followed by a description of potential methods. Next, we will discuss an appropriate research design. Then, we will discuss a rationale for the design. Ethical issues will also be addressed, followed by a summary. The research question. Does alternative group cognitive behavioral therapy, also known as GCBT, increase therapeutic outcomes for patients with depression who are medication resistant versus patients with depression without medication treatment? What makes this an important topic and research question? Well, the success of mental health for patients is important for the well-being and quality of life. Researching alternative treatment methods for patient health is critical to outcomes for patients in the field of psychology. Research shows that group therapy is a preferred method. Group therapy is a selected method to treat a wide variety of mental illnesses. Personality disorders are an example of mental illnesses which may be medication resistant to therapy. This is why it's important to seek alternative treatment such as a group therapy. Keep in mind this is about medication resistance. Last, some patients do not respond to medication therapy, or they can respond better with alternative therapy, and this therapy can also be added on. Okay. A brief literature review. Let's discuss the literature. The literature review covers 2 studies about the effects of cognitive behavioral therapy, CBT, on medication-resistant patients with various mood disorders. According to the selected study, many patients with anxiety disorders still show symptoms after evidence-based treatment. For example, after receiving medication. The test used in this study was the Coordinated Anxiety Learning and Management, also known as the CALM trial. 2 relevant published studies. The first study by Campbell-Sills, entitled Improving Outcomes for Patients with Medication-Resistant Anxiety, Effects of Collaborative Care with Cognitive Behavioral Therapy. The next study, entitled Dysthymia and Apathy, Diagnosis and Treatment, Depression Research and Treatment. So if you don't understand dysthymia, that's also can be considered a persistent form of depression. And this next study B is by Ishizaki. So these are the 2 studies that we are going to evaluate. Also, I would like to add that if you're not clear on what cognitive behavioral therapy is, it is a group setting where patients with mental disorders and mood disorders can get together and discuss and process using their own narrative of experience what their symptoms are like, and they are coached and suggested on how they can interpret their emotion and responses to their environment in different ways. So let's break it down. You're in a group. Cognitive has to do with how you perceive things with your brain, and therapy, counseling and coaching, and in a therapeutic environment in a group setting. So that is what cognitive behavioral therapy is, basically teaching you how to have different behaviors based on how you think. So, and then you're in the group, so the group experience helps you to learn to do this. That is cognitive group behavioral therapy. Let's continue. 2 relevant published studies continued. Now, the main points of study A are first labeling the patients who met the criteria for being medication resistant. These are patients who met the DSM-4 criteria for several mood disorders despite medication treatment. A within-group analysis was conducted to measure the effects of the group cognitive behavioral treatment on patients versus patients who also received the medication treatment. Results show 58% responded, 46% remitted. Patients who had cognitive therapy plus medication did not fare much better than those who only did cognitive behavioral therapy, but an increased dose of CBT produced better outcomes. Study B highlights how understanding the viewpoints and causes on treatments is partly how depression is distinguished between apathy and depression. Is partly how dysthymia is distinguished between apathy and depression. That is what's highlighted in study B. Let's continue. 2 relevant published studies continued. Study A addresses ethical standards by using internal review boards to ensure researchers apply ethical standards by obtaining informed consent. Study B highlights the importance of understanding the etiology of the disease of mood disorders. 2 relevant published studies continued. The specific experimental research design used in Study A is a true randomized experiment based on data from the Coordinated Anxiety Learning and Management Trial, or CALM. Study B highlights why qualitative measures are useful for this topic, explaining how qualitative measures would assess the differences between major depression in a partially remitted state versus dysthymia, since both disorders present symptoms of apathy. So they're basically making a distinction between dysthymia and depression because it's a fine line. And they're stating that both dysthymia and depression has symptoms or can present apathy, or they present as apathy. Let's continue. Potential methods. Parallel mixed methods design can be described as concurrent mixing of qualitative and quantitative methods used as different studies for one research project. The main point here is that the qualitative component is more significant. Next, sequential mixed method design. Qualitative is a sequential mixed method design where the quantitative study is for the more dominant qualitative one. Next, interpretive phenomenological analysis, or IPA. Okay, let's try that again. Interpretive phenomenological analysis, or IPA, my favorite technique. Approach explores how people perceive their experiences. Narrative analysis is another appropriate design for this question because it involves analysis of how people recall and construct the story of their experience through narration. Next, rationale and appropriate research design. For this design, control group would have 6 dysthymia patients who do not receive medication treatment. Okay? The treatment group is going to have 6 dysthymia patients who are medication resistant and still show symptoms of the disorder. Okay? The pretest would be to measure the symptoms of the patient. Alright? Alternative treatment would be the group therapy, the cognitive behavioral group therapy, which would be applied to both groups. Okay? Last, an analysis would be conducted to determine the effects of the added treatment to both groups. Ethical issues. There are several. Application of ethical principles to my design shows how some participants could be affected by these types of qualitative measures. For example, dysthymia patients and participants who are deaf, blind, elderly, or also physically disabled might require certain accommodations. According to Section 3.01, Human Relations, titled Unfair Discrimination of the American Psychological Association, it is important to protect these social culture issues by not discriminating. For example, an informed consent form in Braille for blind participants or a sign language interpreter for deaf participants could be provided. In this design, respecting the social cultural rights of blind participants with an informed consent in Braille will also protect their privacy. Next, ethical issues continued. Outliers are considered participants who can pose threats to validity. If researchers cut corners, results will not be valid. It can be helpful for researchers to let an assistant double-check their work, and also this would prevent from external threats to validity. For example, if a researcher failed to keep accurate records of contextual origin of study examples, studies can be evaluated to manage such threats to validity. One ethical standard to consider is the training and educational programs should be current. Information should be up to date regarding training manuals and/or programs. According to Section 7.02, Descriptions of Education and Training Programs of the American Psychological Association, it is ethical standard to make sure that descriptions of education and training programs be accurate. Next, conclusion. Let's summarize. Does alternative group cognitive therapy increase therapeutic outcomes for dysthymia patients who are medication resistant versus dysthymia patients who receive GCBT without the medication treatment? I think we've answered that question. And the question is yes. Next, the success of mental health patients is important for well-being and quality of life. This is why this topic is so critical to psychological research. Next, this literature review covers 2 studies about the effects of cognitive behavioral therapy, CBT, on medication-resistant patients with various mood disorders, including depression and anxiety. According to the selected study, many patients with anxiety disorder still show symptoms after evidence-based treatment. Another reason why this research is very critical, because the outcomes that patients receive from therapy should be therapeutic outcomes. They should decrease symptoms, and it should be beneficial and as least harmful to the patient as possible. And that's the reason why it is very important to have these types of studies, because if patients are medication resistant, there are alternative methods out there that can help them, such as CBT therapy. By the way, GCBT and CBT is the same thing. It's just you're saying group cognitive behavioral therapy, or you're just saying cognitive behavioral therapy when you're making that difference. Next, in summary, parallel mixed methods design can be described as concurrent mixing of qualitative and quantitative methods used as different studies for one research project, with the qualitative component being more significant. And this is my favorite approach, along with IPA and narrative analysis. I think mixed methods design with the qualitative approach being more significant is definitely the way to go with this particular topic. And last, in summary, application of ethical principles to my design show how some participants could be affected by these types of qualitative measures. And in this area, we addressed patients with concurrent disabilities, such as being deaf, blind, or elderly, and ways that we can make accommodations for them in order to prevent discrimination. I hope that you have enjoyed this presentation, and thank you for listening.